Good evening, friends. Today we are going to talk about spine sign in Efast. Efast is very important component of POCUS, that is point of care ultrasound, and FAST is basically focus assessment with sonography in trauma patient, and EFAST is extended fast that involves the lung ultrasound also. So we are basically looking for fluid inside the peritoneal cavity, pericardial cavity, and thoracic cavity in EFAST with various EFAST views. So today we are going to see the spine sign. What is the spine sign in EFAST? So if we see the normal scan in the right upper quadrant, this is the liver, this is the kidney, this is the diaphragm, and these are the shadows of the spine, vertebrae. So we will see what happens. So here you can see the spine shadow below the liver and below the kidney. But if you go beyond the diaphragm towards the lung, you cannot see the shadow of spine. Why we cannot see it? Because lung is filled with air, and air doesn't allow ultrasound wave to travel towards the spine segment. But if patient has any fluid inside the peritoneal cavity, ultrasound wave will travel toward the spine, and we can see the shadow of spine beyond diaphragm also. That is called spine sign, and we will see in next video. This is spine sign video. Here you can see patient has some pleural effusion. We will see in the video. This is the liver, this is the kidney, and you can see the fluid collection between the liver and kidney, that is in Morrison's pouch. So patient is positive EFAST, patient has some free fluid. It may be peritoneal fluid, clear fluid, it may be blood, it may be pus, or it may be urine in case of ruptured bladder. It can be anything, but there is some free fluid inside the peritoneal cavity. And here you can see this is the spine shadow beyond the diaphragm. We will see in the video also. Here you can see there is spine shadow beyond diaphragm. So if patient has spine shadow beyond diaphragm, it proves that patient has pleural effusion as well. And here you can see there is some fluid collection inside the pleural cavity also. And here you can see signs of consolidations also. So this is how you can make it whether spine shadow is going above the diaphragm or not towards the lung. And if you find it, it suggests that patient has pleural effusion or some collection inside the pleura. So here you can see there is a fluid collection in Morrison's pouch, and you can see the fluid collection inside the pleura also. If we go to next slide, this is scan in the normal scan in the left upper quadrant view. This is the spleen, this is the kidney, and this is diaphragm. Again, we cannot see spines beyond the here you can see the spine up to the level of diaphragm, but towards lung we cannot see the shadow of the spine. But if there is a again pleural effusion, we will see in the next video. Here you can see positive spine sign. You can see the vertebral shadow beyond the diaphragm towards the lung also. This is the spleen, this is somewhere here the kidney, and there is perisplenic collection. So this is positive left up EFAST in left upper quadrant view. So if we scan upward, you can see there is a pleural effusion. This is pleural effusion, and you can see spine shadow beyond diaphragm. This is diaphragm, and you can see the shadow of spine beyond diaphragm also. So here you will clearly see that lung is floating inside the pleural fluid. So there is a fluid inside peritoneum also, and there is fluid inside pleural cavity also. So this is how you can diagnose pleural effusion along with pleural free fluid collection inside peritoneal cavity. So this is the importance of E-spine, and you can diagnose pleural effusion with it. Thank you very much.